I am a wife, I'm a mother, I'm a daughter, I'm an aunt, I'm a fitness instructor, I'm a small business owner, I'm a dog owner. My name is Corinne Brown. I am born and raised in Savannah, Georgia. I like who I am. I feel comfortable in my own skin. I am a Georgia peach. I first heard about Obagi Nu Derm system from my mother. She brought it home and suggested that I use it, and I've been using it ever since. Her skin is gorgeous. She was always very adamant about the sun. I was the child in the pool with zinc oxide all over my face, the hat. I've just always had very fair skin. When I moved to Savannah, it was a pretty hectic time in our lives. I just kind of lost I call it my rosy glow. I just didn't feel good about my skin, and I didn't feel confident about the way I looked. The dark spots started to come back. I didn't really like the texture of my skin, and Obagi Nu Derm system brought my skin back. I get up in the morning and I start with the cleanser, which is wonderful. It's very smooth, it smells divine. I love the fact that Obagi Nu Derm system is numbered. It makes it just so much easier to use. And on to my next step, which is the toner. Number 3, the clear. If you have sunspots, this is what fades them. And then I move on to number 4, and that is your exfoliant. And to me, it really doesn't even feel like an exfoliant. It goes on super smooth. To hydrate, and that's your moisturizer. And the last thing I use is their sun shield. It absorbs quickly, doesn't leave a white film on your face, and then I get the excess off and I put a little bit on my hands. And that's my morning routine. I notice a difference pretty much within a couple of weeks. It keeps my skin looking the best that it possibly can look. The Obagi Nu Derm system makes me feel very confident, and I think a little sexy and sassy. The advice that I would give to women my age is, I think skincare is very important. Exercise, I think, is imperative. Anything just to get the blood pumping.
Get ready, sucker.
Something about hitting something that is just so cathartic. Boom. People always tell me I look young for my age.
When I first met Corinne, I thought she was in her mid to late 30s. Her skin is gorgeous.
I am 49 years young. My skin was glowing when I met my husband because I was using Obagi. We have this beautiful child named Harris Lawton Brown. He's 7 years old. He is full of beans.
You want to throw the ball?
He's just a bright spot in my life.
I caught it! I think her skin looks really good.
Your skin and your face is your gift to the world, and so I think it's very important to put your best face forward. Try to be the best that you can be. I think the Obagi Nu Derm system has kept age at bay for me. And I think it's going to keep it that way through my 50s and 60s, hopefully 70s and 80s.
Important safety information. Some products in the Obagi Nu Derm systems contain hydroquinone. Contraindications. People with prior history of sensitivity or allergic reaction to these products or any of their ingredients should not use them. The safety of topical hydroquinone use during pregnancy or in children 12 years and under has not been established. Warnings. Avoid contact with eyes, nose, mouth, or lips. In case of accidental contact, patient should rinse eyes, nose, mouth, or lips with water and contact physician. Sunscreen use is an essential aspect of hydroquinone therapy because even minimal sunlight exposure sustains melanocytic activity. Contains sodium metabisulfite, a sulfite that may cause allergic-type reactions, including anaphylactic symptoms and life-threatening or less severe asthmatic episodes in certain susceptible people. The overall prevalence of sulfite sensitivity in the general population is unknown and probably low. Sulfite sensitivity is seen more frequently in asthmatic than non-asthmatic people. Precautions. Also see warnings. Treatment should be limited to relatively small areas of the body at one time, since some patients experience a transient skin reddening and a mild burning sensation, which does not preclude treatment. Pregnancy Category C. Animal reproduction studies have not been conducted with topical hydroquinone. It is also not known whether hydroquinone can cause fetal harm when used topically on a pregnant woman or affect reproductive capacity. It is not known to what degree, if any, topical hydroquinone is absorbed systemically. Topical hydroquinone should be used on pregnant women only when clearly indicated. Nursing mothers. It is not known whether topical hydroquinone is absorbed or excreted in human milk. Caution is advised when topical hydroquinone is used by a nursing mother. Pediatric usage. Safety and effectiveness in children below the age of 12 years have not been established. Please see full prescribing information at obagi.com/patient/product-line/nu-derm/overview.